our dialogue. Greetings to all the panelists. I see Jay, Natasha, I see you're also logged on. Welcome. Sudhir is also logged on, and Non. And then our hosts, Zama and Tobile, are noted. We're live on YouTube as well. So if any of you should have some connection issues, please feel free to also go onto the Water Research Commission YouTube page, and you're able to follow the discussions from there. I'm going to start the meeting. It is 1:59. I'm going to try to respect our time. We've allocated an hour 30 minutes for these engagements. We've got quite a full program, which I will take you through. But I think let's start with some house rules as the delegates continue to join us. Just a reminder, if you're not speaking, just ensure that your mic is on mute. When it is your turn to speak, please remember to unmute your mic. I know I always forget to do that, so please remember to unmute your mic. If you're a delegate, you will notice that you've got some restricted access to the functionality of Zoom. Our host is controlling the mics as well as the videos. If you do want to say something or ask a question, make use of the chat box, use the Q&A to direct questions to our panelists, but do so by raising your hand, and I will note those hands and we'll take the questions. Please note, presentations will be sent to all of you, so all registered participants. We had over 100 registered participants, so each of you will get a copy of the presentation after this session. The recording will also be made available. Jay, please mute your mic while I'm just doing all of our house rules.
The right link.
Jay?
No, that's a wrong one. You needed to take Tobile's one.
Jay, please, can you mute your mic? This is a good example of what not to do. So when you are talking, please mute your mic. We will ensure that we have a copy of the presentation made available to you, as I said, after this presentation. And we'll ensure that we send you a recording of this presentation as well, 24 hours after we have engaged. It is now 2:01. I'm just going to take you through a high-level view of our program for today. If I can have the program displayed so that we can just high-level see what the day has in store for us. The program is displayed as you see it on your screen. There will be a few shifts. The one shift on the program is the item for the Department of Water and Sanitation, scheduled for 3:30. We do have a representation from the department that is replacing the Deputy Director General, Mr. Anil Singh, and I will introduce our stakeholder and partner when we get to that point in the program. Please also note that we have time allocations. I'll keep a close eye on the time, and should we need extra time, I will ensure that we allow for that. We've allowed for a little bit of engagement. We've got 2 sessions. We'd love to answer all of your questions, but please, if you can make use of the chat box to ask your questions, and any of our panelists, this is a note to the panelists, if you can answer the questions to save time, please do go to the chat box and keep an eye on the Q&A in order to be able to answer those questions. So welcome, delegates, and welcome to our panelists. And firstly, I'd like to keep, if you can just keep our program up for 2 seconds, Tobile. The welcome for today will be done by Mr. William Moraka, who comes from our partner organization and a friend of the WRC, SALGA. So William, if you are ready, I call you onto the virtual stage just to give a little bit of a context of the day and what our delegates can expect. William will give us some welcome remarks and also just frame the context, and then ensure that we all know why we're here today. Welcome, William. The stage is yours.
No, thank you very much, Program Director, Facilitator, and welcome to the colleagues. I had prepared a 4-slide presentation. Kosi, if you don't mind, I can just flag it from my side and begin to indicate. I'm sure you can see it. Can you see my presentation? Yeah.
Yes, we can
Yep,
see
we
it.
can see it. Thank you.
Great. So in the first instance, let me welcome all of you, and we are really humbled for your presence here, and we look forward to the insightful presentations that you're going to share with ourselves. But importantly, I thought that let me just fly to this particular slide just to indicate that when we started some time ago, we had seen some misalignment in our own opinion, organizationally and in terms of the science out there, the processes and the methodologies or the methods, including the resource and efforts. And I thought that if we can bring ourselves together under one roof, we should be able to attain the objectives that we've set ourselves towards a water sector collective response to COVID-19. Importantly, that we've traveled this road for a long time. And as you see that the theme for this road has been engagement and forging partnerships. And that's what we've been doing all along. And we are quite excited that the journey is beginning to yield the results that we're looking for. And one of the outstanding issues, and you'll see in my concluding remarks, is to ensure that we need to regularize our relationship so that we know that it's firmed up. But importantly, and you'll see these 5 R's wherever Selga presents, we have been challenged by our CEO to use these 5 R's. And I thought these are also relevant in the context of what we want to achieve today. And I won't go into the details, but suffice to say that we are beginning to reimagine a responsive water sector that is innovative in response to COVID-19. And really our return on the investments that we will be putting together collectively is to ensure that there's prevention of COVID-19 further to our communities. And I won't go into the details about the 5 R's, but I think if we could reflect on these going forward, I think we'll be moving in the step in the right direction. And then lastly, that as we're building this national platform, it's important that we demonstrate passion. I think we've done that very well. Our partners, you've come on board, and we welcome all the wisdom that you're bringing into this platform, including the resources. And the image on the right-hand side, or on my right-hand side, begins to indicate that there is light at the end of the tunnel. And I think we are beginning to see that through this collaboration. In my concluding remarks, Program Director, I wish the audience to note the journey thus far and the need for us to regularize this relationship. And I think there's a quest and thirst, colleagues, collectively, to look at this surveillance program, in my own opinion, at 4 levels. Firstly, within our respective organizations. Secondly, within our localities. Thirdly, regionally. And then lastly, at the national level. So we want to see this as a kind of a bottom-up approach. And we are quite humbled and pleased that today we've got all of you coming to support us in our endeavors to develop this national surveillance program. So Chair, with those words, I wish to thank everyone, and we look forward to further discussions. Thank you so much.
Fantastic. Thank you so very much, Mr. William Moraka, who represents the South African Local Government Association, a key partner on this journey. Organizations to note that are with us today: the World Health Organization is also present, the Department of Water and Sanitation, the Department of Human Settlements, both of which are key departments and partners in this program, the NICD, as well as the Success Network. So we welcome you all as we gear up to listen to our progress as we kick off the 2nd phase of our journey towards a national surveillance program. So without taking more time, I call up onto the stage Mr. Jay Bagwan, who will be talking about this national wastewater surveillance program in South Africa and our progress on this journey. Mr. Jay Bagwan, please, you're welcome onto the virtual stage to share your presentation with us.
Okay, good afternoon to everyone attending this seminar. I, for some reason, can't get my video to start. Here we go. So, it's a privilege being here and sharing a few words around, what started off as a challenge, and, the response has been quite rapid. So first and foremost, I want to acknowledge the WRC leadership for investing and showing determination and like they say, putting the money where the mouth is on the issue of accelerating the science and application around wastewater-based surveillance. I also want to thank SALGA for their support from a municipal perspective, but all the new partners that we have grown together with, and as William said, that it is a partnership. The National Institute of Communicable Diseases, the Success Network, the private sector, all of them have sort of responded, more than adequately in the South African space to this challenge of complementing and supporting the national initiative in fighting against this pandemic. So it has been a team effort to date, and my colleagues are going to share what we have achieved. But the important thing is that we have responded as a South African sector that has put our science community, our practitioner community on the global platform as leading, some of the application of what we're doing around wastewater-based surveillance. But today is a very important point, whether we call it a watershed or a sewer shed, I don't know which one is right, but for me, it's a turning point in our efforts around, moving from the first phase of establishing the science and the methodologies into this pilot phase of organizing for the logistics around a more proper wastewater-based surveillance initiative. And it's what I call where science starts meeting action, okay? And as we do that, the science will continue to grow. But it's time for all of us from the science community to grow up. And it's time for us to show the impact on what we can deliver in terms of supporting the national initiatives, as well as contributing to slowing down any emergence of the second and third waves. So this phase that we're moving into is the catalyzing phase. It's a phase for us to contribute to the bigger story and the history of our contribution in fighting this pandemic in a collective manner. And our actions will tell on how successful we are, in terms of what we deliver. So it's for us, to grow up. It's for us to also be humble and shed away our competitions and work collectively towards meeting this objective. That the pathway, creates an opportunity for us in strengthening water quality monitoring in general into the future, and water quality monitoring and water and wastewater-based surveillance is going to become a very important cornerstone in our scarcity discourse. And we should see this as that opportunity offered by COVID to organize for a bigger impact, a more longer term impact. So we shouldn't waste this opportunity in what we're going to do. And, it's also building capacity and building the networks in ensuring that, we become more effective, we become more cost effective, and we make the difference that we set our path towards. It's also time that we, reached out, and this is a plea to all municipalities, that it's time they came to the party, because they are an important equation in the success of the story, okay? And, we cannot be complacent moving forward with what we're seeing happening across our borders and internationally. And it is a very important time for us to accelerate and move forward. So from my side, it has been a privilege to work with a broader team at the WRC and outside the WRC, with members from the Success Network, etc., that provide tremendous learning and acceleration on where we have gone and where we have got to. And as well as the global community in providing us the support and the necessary knowledge to get us to where we are. So with that few words, I want to say all the best to the next phase, and to all the teams that would now become more involved in it. The ball's in your court, and let's show the world and our national counterparts what we're capable of. Thank you very much.
Thank you very much, Jay. Mr. Jay Bhagwan is the Executive Manager of the key strategic area, Water Use and Waste Management, and he can put his details in the chat box so you can connect with him should you need to. What the two speakers have both highlighted is that this phase really symbolizes this melting pot of collective action and how our collaboration has this catalytic impact. So without any further waste of your time, can I welcome Dr. Natalie Mayette, who is the Deputy Director of the NICD, and she will be sharing with us on building a platform for long-term wastewater and environmental surveillance. Welcome, Dr. Natalie Mayette. The stage is yours.
Thank you, Chair. Are you able to hear me?
Yes, I am, Dr. Natalie. I can hear you clearly. You're welcome to also put on your video when you're ready, but we can hear you clearly. Thank you.
Okay, thank you. Apologies for the delay. I've just had some connectivity problems. So thank you, Program Chair, and thank you to the Water Research Commission and all the colleagues for giving me the privilege to present this this topic. And certainly, you know, the title was really an apt one in terms of the terms building a platform for long-term wastewater and environmental surveillance. Building implies that we're starting, you know, and we're developing, we're designing, we're going. The platform gives it a sense of this very strong base. And the long term that, you know, we're in it for the long haul, we're in it for sustainability. And certainly environmental surveillance is something that's really a key neglected aspect that we need to collectively focus on. So I thank you for giving me the opportunity to share what we've done and to provide the contextual framework, the legislative framework for the creation specifically of surveillance platforms relating to what we intend to do. So globally, Nigeria was the first country ready to start environmental health surveillance for polio virus way back in 2011. And subsequently, there's been a number of pieces of legislation that have been adopted and endorsed by the UN General Assembly, which speaks to environmental surveillance and strengthening the platforms to do that. So the Sendai framework recognizes a holistic approach in terms of managing risks associated with both natural and human-induced hazards for prevention, preparedness, response, and recovery. And it does include now biological hazards. Certainly the SDGs and Agenda for Sustainable Development, particularly Goal 6, aims to ensure the availability and sustainability of water. And I've just put the links. And WHO has also put out very recently a document for public health surveillance specifically aimed at COVID-19. But we also have the WHO International Health Regulations. And I'll just go through that in the next slide. And it's really opportune today as we celebrate One Health Day that we're launching this initiative, because certainly from a One Health approach, you want to deal with human, animal, and environmental health as a key strategic imperative to address any health issue. So in terms of the international health regulations formulated by WHO in 2015 and implemented in many countries in 2017, it's got 19 core capacities with 4 key objectives. And these objectives translate into the prevention, the detection, the responding, and a whole range of others to address some of the challenges that we face. And I've highlighted in red where the surveillance that we are addressing in terms of wastewater surveillance falls into. And so it actually frames the context in which we function. Now, I know that in South Africa, there are more than 200 pieces of legislation that deals with water quality, environmental health, but I focus specifically on the contextual framework for surveillance. And when we talk surveillance, there are 7 key aspects that we need to consider, ranging from data governance to data quality, collection, processing, storage, dissemination, and of course the costs and the benefits of doing all of this. And the frameworks in which we will operate to achieve our objectives rest in, amongst others, the National Health Act. There's a 370-page document relating to e-health and surveillance strategies and how to collect data, disseminate data. There are a whole range of district health management information system documents, the National Health Insurance Green Paper, the strategic framework, various strategic frameworks. But what I want to highlight, which is important, is this document in the middle called the National Public Health Institute for South Africa. And this has been really recently assented to by the President in Parliament. It needs to be proclaimed. So regulations are developing. But this speaks to the establishment of a National Public Health Institute for the country who would be responsible for the surveillance of notifiable medical conditions, but also conditions relating to non-communicable disease, occupational health and safety, cancer, injury and violence prevention, and environmental health. And this institute certainly will create the platform for the curatorship of data from multiple sources into a data mart that can be disseminated, distributed for use for public health action. And if you look at this diagrammatic representation on the left-hand side, it just shows schematically what we currently have, but also how this particular surveillance platform fits into it. So we get data from the National Health Laboratory Service labs. At this point in time, for COVID and other communicable diseases like salmonella, typhoid, and other polio, We get data from private labs, we get data from universities, our research collaborators, and I put in green the water treatment plants and all our partners and clinical data and clinicians. So this is not an exhaustive list on the left-hand side. And certainly the more data feeds that go into the surveillance data warehouse, the greater and the richness of the data, and the more we enhance the data for public health action. So it goes through a process of automation, manual verification, electronic algorithm deduplication processes, and then it goes back to alignment with the collaborators to say, is this actually the picture that is really happening on the ground? Is this reality? This is what we're doing with our provincial counterparts on a daily basis. So it goes into the data mart, and what comes out of it is the reports for action for various stakeholders. And we need to determine collectively the nature of those reports, and Melinda is going to go through some of that in her presentation. We need to determine the frequency of those reports, who needs to know, and what information would be relevant for them and at what time. Certainly, what does the public need to know, and what are the public dashboards that are interactive that the public can engage with? So if you want to know in your area, what is the prevalence of a specific disease, you can go into that. And Melinda will speak to that as we go along. And then, of course, data must be shared with all stakeholders, with modeling teams, in determining what they can do with the data to influence public health. So really a platform that we wanted to be standardized, that speaks to wastewater and water epidemiology, that's accessible, but also provides us with the opportunity of an early warning system. So it raises the flag when we start picking up cases so that interventions can be put in place as a prevention tool. And what I would like to achieve, and certainly our discussions with the Water Research Commission, is that we use this as a model going forward, not only for the COVID outbreak, but also for other pollutants, for chemicals, and for measuring disease burdens as a result of water quality and other wastewater and other environmental health surveillance. So this is just a very a quick representation of the current wastewater treatment plants on a GIS map, mapped with all the municipal districts. And thank you, Gina, for providing this information of the GIS codes. And this is just an example of collaboration that happened literally overnight. We didn't have the GIS codes of the wastewater treatment plants. Gina provided them. We plugged them in onto a GIS map with another collaborator. And lo and behold, this is what we can see. This is just a very schematic representation on a GIS map with a legend that's not very sensitive of the current water treatment plants in the Gauteng area, in KwaZulu-Natal, and certainly there's one for Western Cape, and it needs to be, we need to drill down into those GIS maps to make it a lot more user-friendly and a lot more influential in terms of information for action. So some of the considerations as we move forward, certainly this is complex, but I do believe with the extent of the partnerships, we can have an integrated approach to addressing some of the challenges we face. And those partnerships across public and private sectors, across between scientists and our communities. And it does, as Jay has mentioned, bring an opportunity for human resource development and capacity building in municipalities and across the board. Our tools and our equipment and our technologies, I think we constantly need to explore, are they relevant? Can we push the boundaries in moving towards robotics? And AI solutions, review of our existing networks and how do we expand those networks. Certainly we want this entire project to be inclusive, and to assess user needs and how do we develop these collectively. So in essence, we plot it with spatial orientated data, time orientated data together with relation orientated data. Our focus has to be on sustainability and the cost effectiveness. And ultimately, what we all want to achieve is data for action to improve the lives of the communities and the country in which we live and our global community. So thank you, Chair. I would acknowledge all our various partners that have played an integral part of getting us to this point, and we look forward to the further collaboration and working together and learning the lessons as we charter this journey forward. Thank you, Chair. Over.
Fantastic. Thank you so much, Dr. Natalie Mayet. You definitely did not disappoint, and you built quite a convincing argument for actionable data. And there are really some exciting things that have already been done in terms of what you're building towards the National Public Institute of South Africa and how you can use data in order to fast track and catalyze those efforts. So thank you so very much for that input. We're excited to see what that impact is going to have on the program that we have partnered with you on. If you can kindly just stop the sharing of the screen while we introduce our next speaker. So our next speaker is Dr. Kate Medleycott, who joins us from the World Health Organization. Dr. Kate's title is The Relevance of Wastewater-Based Epidemiology for Tracking COVID-19. You can see that I'm a marketing and communications person, and some of the science technologies are tongue twisters for me. So welcome, Doctor. Please, can you proceed to share your insights with us?
Okay, can you hear me now and see my screen?
We can hear you and we can see your screen.
Wonderful. Okay, so yeah, my name's Kate Medleycott. I'm the Sanitation Wastewater Team Leader at WHO, and I just want to give you a really quick sort of overview of the WASH COVID response and then dive into some of the elements of surveillance specifically for COVID, but also this really interesting discussion you're having about going broader than that and actually thinking about environmental surveillance for a range of public health issues. So just quickly, some of the numbers, I think you're all following this on the news. You know, we're up at over 1.2 million deaths and 48 million cases. So certainly we're not near the end of this pandemic yet, even though we're all becoming rather tired of it, I think. In terms of the response, WHO is guided by these three main documents, and many of us here are, are water professionals of some variety, and perhaps we would think it's obvious that water aspects are included in the response. In fact, it's been quite an effort to make sure that it is included in there as essential services, and you can see that the 5 main areas we're focusing on here in terms of WASH, which are really around keeping those essential services running, making sure we have hand hygiene, focusing on healthcare facilities, and not just facilities, but also behaviour change. So you might be wondering, where's the environmental surveillance in there? Don't worry, it's not lost, but we really are working on keeping the focus on essential services and hand hygiene primarily. And so with that in mind, the big initiative that's been launched as a result of COVID has been this Hand Hygiene for All initiative, which is frankly something we've been really neglecting in the water sector for some time. In terms of the guidance, so I don't want to sort of get, I'm sure many of you kind of know all of this anyway, but these are the big sort of takeaways from the guidance we've put out on WASH and COVID more generally, which is of course around frequent hand hygiene, the effectiveness of environmental hygiene with using disinfectants, reminding people that are just good, solid wash interventions and the guidance we already have still applies for COVID. So we don't need to reinvent the wheel in that regard. And then wash investments, of course, we want to make sure that they're well integrated into the response planning and acknowledging that this is, not just about COVID, but as we see in much of the public health data, the kind of social distancing and additional hygiene that's been put in place for COVID is actually having an impact on a whole lot of infectious diseases. Again, I just wanted to preface with this because I think sometimes when people hear about environmental surveillance, there's a tendency to misunderstand that might mean that COVID is infectious in wastewater. All of the evidence so far indicates that risk of transmission from feces and wastewater is very low. Yeah, and likewise with both in drinking water supplies, wastewater, feces, and in fact, even surface transmission. It seems that the risk of transmission of COVID through fomites or surfaces is in fact very low. But because we can detect these RNA fragments in wastewater, it does offer this really interesting opportunity to look at environments to support the public health. So I'll pivot more to that piece now. So the resources that we have on this is a scientific brief, and find at this link here, which sort of summarizes WHO's position on this. In fact, it's not really a position, hasn't made a recommendation for or against environmental surveillance for COVID, but notes some of the emerging use cases and also some of the considerations which I'll get to. And there's actually quite a lot of networks working on this in particular. But I also wanted to, highlight, of course, it's not kind of new as a concept. The polio surveillance network has been discussed by other presenters, and it's really clear that there has been a fundamental part of the success of the polio eradication program, or near success, and likely also with antimicrobial resistance. We've been looking at environmental surveillance for that using ESBL E. coli as a target, and investigating antimicrobial compounds. And there's also kind of broader projects like the Global Sewage Surveillance Project, which uses metagenomics to look at a whole range of things that may be in wastewater. So the concept is not new, and I think it's really important to be looking at sort of these nearer term COVID responses versus like how does environmental surveillance support broader public health surveillance in general. So again, you're probably familiar with this. These are the current locations where the environmental surveillance is happening. So what South Africa is doing is very well kind of networked into these wider efforts. I think what's really interesting for me personally is about South Africa is that you're looking at these non-sewage or a greater proportion of non-sewage communities and grappling with some of the challenges that brings, but also opportunities. I say opportunities because for polio, I mean, they really had to work in those kind of environments. So we need to understand those methodological challenges of working with low sewage setting, and I think that South Africa can really kind of lead the way on that. And just this morning I was on a webinar with Ghana who's starting to look at this for low sewage coverage settings as well. So just to quickly summarize the main points that are in the scientific brief and encourage you to read it. So maybe it's a little loose to call it a hypothesis. I think some of the use cases is really starting to emerge now, but there's still quite a lot of work to really operationalize those use cases. But what they seem to be is the early warning approach, which is certainly happening in the Netherlands, using it as a trigger for more in-depth public health surveillance in places where there's limited clinical surveillance. Also understanding there's the circulation of the virus within the community, and there's been some quite interesting retrospective analyses, kind of looking back at old samples to see when some of the first occurrences were. And of course, there's been a lot talked about with data to action, and that's absolutely true. We want to make sure that this data gets put to good use, but also acknowledging that research for its own sake is actually quite important in terms of understanding the virus shedding dynamics, and also taking us kind of along this pathway to understanding how environmental surveillance can support public health prevention and response efforts in general. So some of the things that are starting to emerge from the research, and we have these kind of 6 points, sorry, to kind of consolidate what needs to kind of be clearer before WHO would make a specific recommendation on this. So first is issues of representativeness. How do you draw on a diverse kind of population, especially in settings where there's low sewer coverage? It's really pleased to see that South Africa is taking a lead on helping kind of unlock some of these questions. The issue of coordination, this is not unique to this this particular issue, but quite often you see the public health community and the water community operating in parallel, and we really have to make sure that integration is happening at the earliest stage if we want to have a data to action link in the COVID response. Cost effectiveness is something we often across the water sector, we're struggling to get as much bang for our water buck. So we really have to understand the cost benefit of doing this, maybe through greater targeting, maybe through greater linkages with other environmental surveillance approaches, for example, making use of the capacity within polio laboratories and so forth. There's some legal and ethical considerations, and Canada has done a nice job of publishing a paper talking about the legal and ethical considerations around environmental surveillance for COVID. Quality assurance, I think at the moment it's actually, maybe a good thing is too strong a word, but I think there's a lot of investigation going on, right? So different organizations are experimenting with different techniques, but within time we need to sort of work towards some sort of quality assurance approach and standardized protocols. And then finally the issue of safety, which I think in terms of COVID, it's mostly a perceived risk rather than an actual risk of COVID infection for workers, but also, taking the opportunity to make sure that lots of our sanitation workers have the basic PPE that they ought to have anyway. And unfortunately, in many cases, the working conditions are not where they should be. So again, an opportunity to strengthen that. So that's all I wanted to say. I've got an outdated promotion for Global Hand Washing Day, but I hope you're all still taking the opportunity to improve hygiene as a result of this. Thank you.
Thank you so much, Kate, for a very interesting conversation. And Leslie London is very interested in a copy of that presentation that you were referring to that speaks to the legal and ethical implications. I think it's the Canada study. If you have it on hand or if it is on a link, if you can share that in the chat box, or if you can assist and share it with the team, I'll connect with you on the side, and then we'll share it with all of our delegates. So thank you very much for that. It is now 14:43. We'd just like to give a little bit of a chance for a few questions. I know Dr. Nhlanhla Gabana is ready and on standby to do her presentation. I'd just like to give one pause. Do we have any questions that we would like to give to our panelists? I've only seen the request for the presentation. All right, we'll give another opportunity for questions a little bit later. And let me not waste any more time. We are smack bang on schedule. So Dr. Nhlanhla, if you have your presentation, if you can share your screen and proceed.
All right, let me try to share my screen. Can you see it, Kosi and everyone?
Perfect. I can see your screen.
All right. Okay. All right. Thanks. Good day, everyone. My name is Nhlanhla Kalebaela from the Water Research Commission. So today I am representing the WRC technical team on water quality surveillance, and I will be giving some insights on the strategic approaches that we are following towards building the National Surveillance Program. And I will also give some progress on where we are and some of the key findings thus far. Okay, so Jay already mentioned that this is part of a larger WRC strategy on water quality, sanitation, and health research program. And also we have then prioritized the national surveillance for COVID-19 as we already are in the pandemic. And as you would see, there is other research that we are doing, linking up nicely to what Dr. Mayet spoke about and also Kate spoke about, the need of actually pulling together these efforts for wastewater surveillance, for the surveillance of other compounds of emerging concern, and also for surveillance of other pathogens, some that we know and others emerging that will be able to, this time around, maybe catch while they're still emerging. And also a lot of other research that really help in framing around the One Health concept that Kate also spoke about. So for today, I'm going to speak a little bit more about the National Surveillance Program. And as you can see that the program is really supported by research that is really targeting the optimization of sampling methods, analysis methods, as well as data management, as well as reporting. So I'm not going to go into details on the research, but I do have a slide just to share some insights on some of the research areas that we're looking to specifically for supporting the National Surveillance Program. All right, so from last time, we already shared that we are following a phased approach, and this phased approach is very important because it allows or enables us to actually learn by doing, and also to start and stop and to be able to incorporate some of the emerging science around COVID. And also looking at our timelines there, you can see that we had given ourselves about 3 months for the proof of concept study, just to actually start evaluating and also applying some of the established protocols and also fine tuning for our own purposes of the National Surveillance Program. And so for today, I am going to give some key findings from phase 1, which has been completed. And then Dr. Melinda Sochad is going to take us through phase 2. So the proof of concept study, it was done in collaboration with the University of Pretoria, Water Lab, and the CSIR, which is our own Council for Scientific and Industrial Research, and also ourselves as the Water Research Commission. So what you see there is the title for our proof of concept study, and the report is available on our website. But I will just pick on some of the key findings from this proof of concept study. So first of all, so what we really gathered from this study was that we could identify RNA. So we got positive results for samples that were obtained from domestic wastewater facilities. We also had positive samples for samples that we collected from the environment, which we really used as a proxy for non-sewage systems. And my colleague Sudhir is going to give a little bit more information on how we'll be taking that forward. So what we gathered from these results is that the results are giving us enough motivation or rationale to actually start expanding and also applying some of the methods that we've already tweaked and fine-tuned so that we can expand the sampling, include more municipalities, samples, and also pair that with capacity building as we bring more laboratories on board towards building up for national coverage or a national picture for the surveillance program. And also as part of the proof of concept, based on studies that we have seen that have been published, we looked at also the potential of using sludge for monitoring or surveillance processes. But what we saw was that there is a high level of inhibition which requires then a repetitive cleanup process for the samples so that you can obtain results, which really would not be ideal for a rapid, for a routine program where we really need the results to inform the progress. As and Kate spoke about that 3 to 7 day lead time as an early warning. So what really we'll do from in this aspect is that we are doing further research to look at optimizing the methods and also to use this purpose, SARS-2 recovery from sludge, for other purposes, for instance, looking at treatment efficiency in wastewater treatment, and also to look at some risk assessment studies, as unlike most of the wastewater treatment plants in the world, ours, there are challenges with regards to operation and maintenance. So would like to really ascertain if there is any risk, even though international studies have already shown that the risk is low. But we will be quantifying that in our studies. And also we would also start looking at data reporting and management, and which really links up nicely to what Dr. Mayette was talking about. So as you would see, Dr. Melinda Suchet is also going to share that at the moment, the reporting is based on the city values, but we'll be looking at on how we can do quantification and also then start building the algorithms for estimation towards prevalence, and also to be able to do the risk maps that we've been talking about. And then another aspect of the proof of concept was to actually look at the methods themselves, which are applicable in our environment, as well as the cost. And as you can see from what we see here is that all three methods for virus recovery were comparable, as the city values were within a particular range, as well as the assays that were used for viral detection. They almost gave results that sat within a similar range, which means that really what we will be doing in terms of interlaboratory proficiency is that any of these methods can be used for monitoring, but every now and then we will need to take those samples for just a validation. And then in terms of cost and what we got from the study, we have a pretty much good idea which methods are cheaper and which methods we can look at in terms of cost. So for those that probably needed some conversion for, because those amounts are in rands, the rand is currently around 16 to the US dollar. So we're looking at just slightly less than $100 per sample. So what I've provided there is the link with the full results and the final report from the proof of concept study. Please do go into our website and download so that you can have full view of the results and also where the samples were taken. And then just to round it off, so these are some of the research areas that we're looking at commissioning specific projects. So in terms of the sampling methods, although we're already running ahead with the PCR-based method, but we are looking at other methods in research. We're looking at your digital PCR, and also there is the emerging field for development of biosensors, for also qualitative detection of biomarkers for SARS-CoV-2 in environmental samples. And also I've already spoken about the long-term plan to start quantifying and also attempt to establish trends and also changes in terms of the SARS-CoV-2 concentrations, and also track the number of cases, look at the circulation of different strains and also the source of the different strain in order to inform on the extent of community transmission. And also I've spoken about the risk aspect that we're doing in terms of analysis of SARS-CoV-2 biomarkers in wastewater, aerosols, and also sludge during wastewater treatment. So I will end there, Chair. Thank you very much. And there is more information on our website. Specifically, there is a dedicated page for coronavirus where there is lots of information. And if there's a specific query that you might have, there is an email address that you can drop your question to. Thank you.
Fantastic. Thank you so much, Dr. Nonhlanhla Kalibaila. Dr. Nonhlanhla is the WRC Research Manager for Drinking Water Treatment and Quality Management. Thank you for those insights. And all the information is where she has just quoted. If you look in the chat box, you'll find that the Canada study has been posted. Thank you, Alex. Thank you, Bernadette. For those of you that were looking for that study, it's in the chat box. So the next speaker that we have lined up for us is Dr. Melinda Suchard, NICD. Dr. Melinda will share the design principles for this pilot monitoring phase. Please, Dr. Melinda, if you have a presentation, feel free to share it. And you're up.
Hi, good afternoon, colleagues. Bear with me while I share my screen. It should be appearing your side.
You can see it.
Okay, thank you to the Water Research Commission for really coming up with the plan to host the seminar and for inviting us to partner in the seminar. And we are really excited at the progress that we have all made so far. And we look forward to moving into the future together. What I'm going to share with you today is around the introduction to where we are at and our design principles for how to conduct the pilot monitoring phase that has been mentioned by Nonhlanhla in the previous talk. And what I will do is just show you, that surveillance has really been the bread and butter of the NICD. For example, for the COVID pandemic, we put out information weekly on our website, including an epidemiology brief and a testing summary. These are put out by the Center for Respiratory Diseases and Meningitis. And I've just taken a few slides from that data to give you a sense of the routine work that is done every week at the NICD. You can see this epidemiological curve of the COVID outbreak to date. You can see the peak in July, the tail off, and now really the big question that everybody is concerned about is will there or won't there be resurgences? But this picture can be more complex if you look per province and particularly if you look per district. For example, here is the data plotted, colored by province, and it's shown here as a weekly incidence per 100,000 population. So it's averaged for provinces that are more or less populous, so that you get an average rate per 100,000 population. And when you look at the data in this manner, there's a lot more information that you can glean. For example, in the orange line is the Free State, in the brown line is the Northern Cape, and you'll see that their epidemics have been very different in character to the other epidemics in the other provinces, in that the Free State peaked, but it hasn't come back down to a baseline. The Free State is really still in their first peak or in their first surge of coronavirus. And similar with the Northern Cape, the Northern Cape has had sort of a prolonged peak rather than a quick peak and then a return down to lower levels. Here is the testing rate, again, per 100,000 individuals. And you'll notice again that the different provinces have very different testing rates to each other. A province, for example, like Free State in the brown line has had quite a high testing rate. The grey line is the Northern Cape. So you see the highest testing rates in the provinces that are currently suffering the ongoing high rates of transmission. But you also see, for example, Limpopo in the blue line at the bottom has had a very low testing rate throughout from March until currently. And that is probably around capacity and testing facilities. And you can plot the proportion of positive tests in heat maps like this. So what is shown here in the red colors is the proportion of tests that were positive, and in the a red color being higher than 20% and very red being higher than 30% positivity rate, and the colder colors being less than 10 or 20% positivity. And this can also give you a sense of where the outbreak is moving and where the hotspots in the country are. But of course, it's subject to limitations. A test positivity rate is subject to the number of tests done. And we do see, as in the graph that I've shown you on the previous slide, that testing rates vary. They vary due to testing demand. And often as the outbreaks are more intense, the testing demand will go up. And they vary by testing capacity. So if, for example, kits are in short supply, then tests will become limited. Provinces also sometimes implement different testing strategies where they are told by National Department of Health they need to increase the number of tests available, or that they should, because of resource constraints, they should limit the amount of tests that they do. So testing strategies may vary by province and can vary over time, which can limit the interpretation of these types of data. So what National has currently proposed in terms of resurgence indicators and tracking when resurgence would occur would be based on a number of indicators. And this is a working document and it's still in development, so it's not for quoting, but it's from a September version. And really what was proposed in this version was that the main indicator for resurgence would be the new number of cases per day, as in terms of lab diagnosed cases. And then there would be also the testing rate as a very important indicator in terms of testing rate per population, and then a number of supplementary indicators. And those supplementary indicators could include the percentage positivity rate, the number of active cases that are still infectious, the number of hospital admissions, the mortality rate, although that's often delayed, 2 weeks post the case incidence is when you'll see the mortality increase, and then the all-cause mortality in case we are missing confirmed COVID mortality deaths. And these resurgence indicators are supposed to assist provinces to interpret their own situation on the ground and to determine whether or not there are interventions required in terms of a potential resurgence occurring. So why and where would environmental surveillance fit in? So the aim of environmental surveillance, as we see it, is to estimate at macro level the infection density in large populations and to track changes in trends over time. And for me, this is a long-term kind of horizon. It's periods of 6 to 12 months and beyond. So in other words, I see it as a routine surveillance system that can show us if we are seeing differences in different geographical areas or differences over time. And in certain metros, we may be able to drill down to smaller population area or population units. And the real advantage of sewage surveillance is because it's not subject to the biases of patient sampling. So therefore, if test kits run out and suddenly the testing rate goes down and perhaps the positivity rate goes up because the tests were limited to only in-hospital patients, that kind of skewing of the data would not happen if you had a consistent water-based epidemiology program running. So the environmental surveillance is an unbiased supplemental data that can be used to build confidence or cast doubt on the national patient level data. At NICD, these are the sites for which we have currently, for which we are currently processing wastewater for COVID-19. I haven't put the names of the actual plants in, but we have at least one site in each of these districts. So Mangaung in the Free State, Tshwane, Ekurhuleni, City of Joburg in Gauteng, eThekwini in KZN, City of Cape Town in the Western Cape, and Nelson Mandela and Buffalo City in the Eastern Cape. And then we are also coordinating results incorporation into our centralized reporting system from Lumigen, a private laboratory, and from the Water Lab, University of Pretoria CSIR group, who conducted the surveillance pilot for WRC. And we have imminent plans to incorporate also from Durban University of Technology, from MRC, and from National Institute of Occupational Health. But these on the slide are the ones that I will show you some preliminary data from. So how we are reporting our results currently is using this simple dashboard developed from our experience with reporting polio environmental sampling results for the African region. We have simplified the dashboard from versions that I have presented to some of those in this audience previously, in that we are really just reporting positive results in a red color, presumptive positive in a yellow color, and by presumptive positive we mean only the E gene positive, because the E gene can be found in other coronaviruses and not just SARS-CoV-2. A negative result would be a green square, and then a gray result would show pending, and an invalid result would be black. So if we plot our results in this manner, here are how they look so far, broken down by province. Here you'll see for Gauteng, what I'm showing you is the list of wastewater treatment plants, the district in which they are found, the laboratory who has been processing the samples, and we have had some parallel sampling happening in terms of method comparisons between ourselves and some of the other labs. And on the horizontal axis here, you see the epidemiological week from January onwards, and with a peak in around week 27 to 30. And I'll show you on the next slide. We will scroll to the right-hand side of this spreadsheet. What I want to show you in this slide is we had some historic samples that we ran, that we had stored over. We had leftover material in our freezers, and we looked for COVID-19. And you can see that all those early samples were negative until around week 21, which is around the time of our outbreak starting, very early on. And you can see immediately thereafter the samples became positive. Until now, they are almost all positive. Here is the continuation of that spreadsheet. So we're looking now from week 25 onwards up until week 43, and we have the rest of the year still to follow. And what you see is at the moment we are still very much in the thick of our outbreak with community transmission, and all our samples are positive. Here is the graph for the Western Cape in terms of the Tygerberg results that have been shared with us so far. There are many more sites that have been sampled in the Western Cape. Through MRC and colleagues, we just still required to incorporate the data. And here is the collated data. This is the NICD data from Free State, KZN, and Eastern Cape, where we have fewer sites, but the surveillance is up and running. So what you see from this kind of reporting format is that it's qualitative. It's a positive or negative answer, which gives limited information. The idea where what we'd like to see happening, and I think a lot of partners in this network are very keen on, is to try and make these results quantitative, to try and use the standardized laboratory methods with recoveries and with other viral reporters and so on, in order to better estimate from our results how strong is the signal that we see, and how many people does it translate to being infected in the draining community. I think this is still a work in progress, and I'll be very interested to learn from others' experiences as we go forward, to see if anyone really manages to get this right. And I think that will be a big step in an exciting direction if that becomes possible. So what we hope to happen is that we will see an expansion to national environmental surveillance. In partnership with the Water Research Commission, the NICD will coordinate a network of participating laboratories who, in collaboration with the Department of Health, the municipalities, the other stakeholders, will be responsible for the site selection and for the communication systems between the field sites and the laboratories. And NICD would be the central repository of the data, and will report the data in the relevant formats, for example, to the National Incident Management Team at National Department of Health, where I already presented these data that I've shown you this morning. I presented it to the Incident Management Team as well this morning. and data will then be also made accessible to the district and provincial health authorities for local action. In the pilot phase of the national scale-up, so for the first 6 to 12 months, we will target the urban metros, namely Joburg, Tshwane, Ekurhuleni, eThekwini, City of Cape Town, PE, and Buffalo City, in terms of expanding the number of wastewater treatment plants that we sample per each metro to give a more comprehensive view of the city as a whole. And you can see there the planned numbers that we have calculated for this coming phase. We want 10 sites in Joburg, 6 in Tshwane, 8 in Ekurhuleni, 10 in Cape Town, 4 in Nelson Mandela, and 4 in Buffalo City. And in terms of the way forward, we are very keen to see how the research and development leads us as to whether we can upgrade from qualitative to quantitative results. And we look forward to learning from shared experiences. In particular, for example, around institutional monitoring. We are at NICD, we often sit with a bird's eye view, a national eye view of looking at the country in terms of its provinces and its districts. But we are less invested in independent institutions, which are often exactly what has to be dealt with the district health authorities on the ground in terms of responding to cases and responding to clusters. And I think we are all learning as a collective here, where is the environmental surveillance best placed, and will it be helpful in terms of that rapid response, for example, detecting an outbreak in an institution and allowing a rapid response. I think what we've learned is that certainly it's feasible and it's technically doable. The issue is that you need to plan that institution in advance, and you need to put quite a lot of resources into monitoring that institution over a certain period of time, very proactively with very rapid turnaround times of results. But if you select your institution in advance, certainly it can be done. And I think some of the colleagues on this call have done so in university campuses. It would be interesting to use this, for example, in prisons, mines, perhaps old age homes. But these really require thinking about in advance and putting a lot of planning into monitoring that one particular institution. And that would allow real-time responding in that target sort of sentinel site. Other than that, we see it as continuous surveillance by province and by district, and we're hoping to be able to monitor trends that will be very important over time when there are big changes. For example, if there's a vaccine rollout, or if there is a resurgence after the December holiday period and then another lockdown phase, it would be very interesting to see how our surveillance corresponds with any lockdowns. So really having a stable environmental surveillance system running will allow us to have before and after data during interventions or large issues that may affect surveillance, that may affect transmission trends. And with that, I'd like to just leave you with our envisaged outputs from this network, which is a publicly available results dashboard, the data trends and patterns used to monitor resurgence, a harmonized sampling design and analysis protocol. We hope to develop an interlaboratory testing program whereby 10% of samples would be retested at the NICD, to develop training materials and guidelines, to establish this national network of laboratories with capabilities for detection and reporting of environmental pathogens, and with a view that this may be expanded beyond COVID in the future. And the municipal partners will be incredibly important to build these networks and to build these partnerships, including if we expand after COVID to other pathogens. Capacity building is an important aspect of the project, and we see this as the backbone of a future national wastewater viral surveillance system. Thank you, and thank you to all the partners so far. Apologies if there are more partners whose logos don't appear here. If so, please mail me and let's correct it, because I think what we are, this is a lovely organically evolved network that has grown up from people who are passionate in their fields on the ground and who have something to add to the project. And that really augurs well for the future and bodes well for a very successful project. I think most of the successful initiatives are usually developed in that manner from a bottom-up approach rather than a top-down approach. Thank you all very much.
Fantastic. Thank you so much, Dr. Melinda. I think it's clear from both presentations, the WRC and the NICD, that a lot of work has already gone into this program, and there's a whole lot more work to do. We now are going to get a progress update from the extended network. Natasha is already putting up her presentation. Welcome, Dr. Natasha Berkowitz, and we hand over to you to share progress of the Success Network.
Hi, good afternoon, everyone. Thanks for the opportunity to share and present at this forum. I think it's a fantastic space of collaborative learning. My presentation is relatively short because it's actually the network partners have, many of them have already spoken and will be speaking at this forum. But just to describe what the Success Network is, how it relates to the various partners in it, and where we envision the network to go in the future. So I am using the City of Cape Town slide deck, but just to say that this network, as Melinda's already referred to, is a collaborative network of multiple partners. So just to describe the Success Network and where it's come from, it stands for the South African Collaboration of COVID-19 Environmental Surveillance System, and that was coined by Melinda Sicard. And it was established early in the epidemic by a collective response by a number of researchers within the Western Cape to start investigating the utility of wastewater-based epidemiology for COVID-19 surveillance. And it's actually organically grown from there to include various actors, stakeholders, role players from across the country. And these include university researchers, municipal sanitation officials, public health officials from both local government and provincial health departments, the NICD, and quite uniquely, private laboratories as well, and as well as the various research councils. And as I said, it includes participants from across South Africa, I think from more than 4 provinces now, and a multitude of municipalities. And what is quite unique with the network is that all activities thus far have basically been conducted with limited budget and internal funding from the individuals involved. So these individuals who are part of the network are obviously passionate about the work that's being conducted, and see the future utility of the work, and thus have put in the budget from internal funding to help with the progress of all of the network's objectives. And these are I think most of the groups involved, and once again, apologies if some of the logos were left off, just showing the variety of stakeholders involved in the network and who are participating. And so this is a truly dynamic network of institutions and individuals that we meet fortnightly on a Friday mid-afternoon to discuss the progress of each of our teams, as well as any issues that may have arisen with regards to the various projects that we are involved in. So it's created a safe space to connect and network, to create collaborations between various stakeholders. And one can see from the presentations that have come before me and that will come afterwards that it's created collaborations potentially between groups that may not have connected previously. We've especially in the initial phases, it was a forum to share best practices and to discuss the progress on the various methodologies used for the lab work surrounding wastewater-based epidemiology. And now we're shifting more onto the utility within, for surveillance in the ongoing epidemic. We often discuss common concerns and barriers to continuing our work, addressing various problems with methodology, and other more practical things such as where's the funding stream coming from. And speaking to that point, it's a space that we've also discussed collaborative funding opportunities, and hence this funding opportunity that's coming from the WRC and the NICD as well, and has been created. And also discussed putting forward joint applications for funding to create stronger proposals. And within this network, the ultimate aim is to create a network of wastewater surveillance within South Africa, and then obviously to use it for potentially for monitoring other diseases. And importantly is that because we have a space where all stakeholders and actors can discuss their work, we're ensuring that there's no duplication of efforts or projects or investigations or sampling. And the NICD has been really instrumental in pulling all of this work together. And so thus far, these are just some of the achievements. This, as Melinda showed us already, establishment of the national dashboard at the NICD with results from 21 wastewater sites. We've successfully detected SARS-CoV-2 RNA in the wastewater from wastewater treatment works in a number of provinces. There's been preliminary establishment of routine surveillance structures for using wastewater-based epidemiology in the Western Cape and within Durban. And we're starting now with the piloting of protocols for surveillance of high-risk populations and institutions, such as prisons, old age homes, and other residences. And we also, individuals who sit within the Success Network have had representation on the MAC subcommittee for surveillance. And so the way forward for our group is that we are now looking at specifically how to publicize the network, media workshops being put together to outline our aims and objectives, to create awareness around the work that the Success Network is doing, so we can broadcast our various achievements. We shifting from the technical phase into the surveillance phase, and hosting a discussion on the utility of the results that are coming out of the wastewater monitoring in actual surveillance activities now and going forward within the epidemic. As Melinda's described, already leveraging off the NICD and WRC funding opportunities to ensure appropriate coverage of South Africa with for wastewater surveillance. And then also an offshoot, which we haven't discussed very much, but has been on the agenda for a while, is investigating the possibilities of sampling from alternative wastewater sources or more informal sewage networks. As we know, much of our population isn't covered by formal sewage networks. So this was really just a flash through what the Success Network is doing, and just to explain the collaborative nature of it. So my email address is here, and you'll get the slide deck, that if there's any partners on this forum who would like to be part of it and connect, please just drop me a line. And it's really encouraging to see over 100 individuals participating in a forum such as this, all directed at one common goal. So yeah, thank you very much.
Thank you, Natasha, for that presentation. And I think Dr. Sudhir Pillay is also on standby to share progress on the non-sewage sanitation environment. And I think we're all very interested to hear how we're doing on that front. Dr. Sudhir, do you have a presentation to share?
Yep, I'm starting it now.
Please proceed.
Hi, everyone. Okay. So you've heard the speakers talk about environmental surveillance and using a wastewater approach. One of the things that most developing countries don't have is 100% sewage coverage. This picture is an aerial photograph of a peri-urban area close to one of the metros. If you look at it, you can see social distancing, space, and shed facilities is common in these type of areas. In terms of this wash sector knows this diagram very, very well. It's the John Snow cholera map. In the 1800s, people actually thought that cholera was airborne, but when these cholera cases were mapped, they found it was linked to a leaking pit latrine that was contaminating a local water source. So this idea of surveillance through these mapping is common in the wash sector. Tracking COVID through wastewater, you've seen a lot of the evidence coming out, some predictive before the actual peaks. There are some correlations with hospital cases, and also within South Africa, we're having our own surveillance system, which has been adequately covered by the other speakers. Why have a non-COVID COVID-19 tool, a surveillance tool? Well, as I mentioned, there's no metro that's 100% sewered. As part of a citywide planning surveillance, there's opportunity to include this vulnerable group within the surveillance. These places are usually high density, unregulated settlements, characterized by vulnerable groups, so low-income population group. Your social distancing is challenging under these circumstances. There's shared ablution for facilities, and there is a reliance on operation cleaning procedures of municipalities. And if they're not sewered, where does all this water go through? There's a need for this case. I remember Kate mentioning the statement, just because the non-sewered environment is challenging doesn't mean we shouldn't do it. It's actually a 2 billion case. Just an idea and a perspective of the areas that we're targeting, quite high density, as I said, shared facilities. We're unsure of the state of the facilities in many of the municipalities, but could we use this area to just a general mapping of COVID within these type of areas for rapid response? I remember Melissa speaking earlier about some of the other provinces where testing was probably there's a lack of testing facilities. Those type of areas are also typified by non-sewered areas also. So we're trying to bring this into the mix. This is a communal ablution block. About 100 people share the block. This one particular example is sewer and connected to sewer, but as you can see, the runoff is quite high in these areas. Could you use these areas as a predictive environmental monitoring? Just some background into the proof of study that was done by Water Lab, and Natasha made mention to the report that's published on our WRC website. Gram samples were taken. Viral recovery was detected, so the RNA was detected in surface water samples, and you can see some of the results. You can find more information about this in the report that's published on the WRC website. But what also was concerning for me was the physical chemical nature in terms of your COD, E. coli was very similar to domestic wastewater. So the potential not only for COVID, but any other wastewater or waterborne disease is quite high. In terms of what we're doing so far, we just launched a TOR. It's about to close on the 13th of November. It's to develop this framework and the tools for the non-sewered surveillance. We've already shown that there is virus RNA can be detected in non-sewered the domain, but how do we incorporate this as part of a similar to a citywide or inclusive of the national surveillance environmental program? We're targeting a minimum of 4 provinces and up to 20 settlements. We want to see how we can coordinate this and include this based on the results into the national environmental surveillance. The previous speaker, Natasha, spoke about vulnerable communities. These are the vulnerable communities that are living in these areas. And so it's important that we have these as part of a citywide type of surveillance. Just an example of some of the challenges we're expecting and expecting to overcome, and you see the picture on your left, that's just runoff from some locally derived wastewater. How would you collect this? How often? Which stream would you collect? It's not only about collecting samples from toilets, but also the runoff from the grey water, the runoff from normal household activities. Which is the best sampling points? How would we sample? And how would this data fit into our national surveillance program? So just an idea and indication of some of the challenges we're expecting. And one of the main products we want to produce from this research is, besides from incorporating to a national surveillance program, is how do you actually sample these areas? Because your non-sewage areas are quite diverse in terms of sampling points. This is the last slide. The WRC does contribute to the International Water Association Task Force. There's various aspects that have been covered. The latest methods, what are the latest trends. Nonchalancha did bring up looking at aerosols and those type of aspects. Also looking at buildings when they're starting up again. Water has been running. What are the implications for that? This is one of the papers we're releasing through the role of wastewater treatment in COVID-19 control. We also did a couple surveys with water utilities to find out what have they been doing in terms of best practice for COVID. That is the end of my presentation, Kosi. It's your next.
Fantastic. Thank you very much, Dr. Sudhir from the Water Research Commission, Research Manager, Sanitation. So the next speaker is from the Department of Water and Sanitation. We'd like to welcome onto the stage Mr. Bashan Govender, who will share his responses, and his perspective would be that of the Department of Water and Sanitation. He is standing in for the DDG, Mr. Anil Singh. Welcome, Mr. Govender, and we are ready to hear from you.
Good afternoon, Kosi. I hope you can hear me loud and clear.
You are clear. Perfect.
Thank you. Look, thank you for the opportunity, and an apology has been tendered by the DDG Anil Singh. I'm just standing in to share the department's perspective. I think at the outset, it's really important that we recognize the role of the Water Research Commission in this activity. We've been hit now with COVID for 11 months or so, and in that 11-month period, within 6 months, we've seen the WRC rise to the challenge, go out, implement a project, and generate a technical report, a very robust technical report. And I'm not sure whether this is driven by the urgency of the COVID or the energy behind the team that has had to run this process, but it's really a commendable output. It's not often that you see these kind of initiatives delivered in such short time frames. And it really then sets the scene in how this scope of work can be amplified going forward. I do believe that on the basis of the success that we've seen so far, Kosi, can you hear me?
I can hear you very clearly, Bashan. You're clear.
I minimized my screen, so I thought I lost you there.
No, perfect.
Perfect, good, thank you. I was saying that we have to recognize that there's limitations in South Africa in terms of our way our wastewater is managed. And that in itself would have not made this process very easy in terms of demonstrating the proof of concept. I suppose some of the success can actually be drawn on the fact that the first world countries have pioneered this process and we may have latched onto it. Now, the important thing for a developing economy like South Africa is that this proof of concept, having been tested and demonstrated and shown to be successful, it will raise that famous red flag when we pick up these COVID spikes. And that red flag is something that I would like to almost draw a parallel to how we have a blue flag status on many of South African beaches. And so this indicator is really a clear direction in how government at all levels needs to respond when we pick up these kind of incidences. Just some areas I think where I would like to see the WRC to try to get more, let me say, meaningful, for the want of a better word. would be on the empirical data sets and the simulation of models so that we can draw an alignment. I recall we talked initially when this project was initiated on the fact that between the viral RNA particles, you can actually have a mass balance, which is suggestive of population size, and then by inference actually draw and determine infection rates in communities. Probably another question that's been asked is the reliance on the wastewater or the sewage head surveillance versus the swab test. We do appreciate that one is sort of a heads up and raises the flag, but we would want to just test the cost effectiveness versus individuals going to a laboratory and obtaining a test. And then probably a limitation that would have to be covered is in terms of asymptomatic individuals. If we rely on the watershed, it's well documented that there are some individuals who will not actually show the signs, the known symptoms of COVID infections, but it becomes clear then that we would have to have that separation so we can have a direct accounting of the number of individuals that are affected in any given population size. Just in terms to move towards the wrap up, in terms of an overall water quality impact, we have to recognize that there's going to be a need for this kind of data to possibly be made periodically available through more advanced monitoring systems. And if these kind of outputs can actually generate data almost in a real-time format, then that would really have its advantages for the way our communities respond to those challenges. And Dr. Pillay then talked about the non-sewage system. Clearly, there are merits of monitoring the incidence of COVID peak of infections in non-sewage systems. I recall going back a couple of months, the Human Rights Commission did indicate that as much as 40% of our population do not have access to formal toilets. And out of that 40%, 55% regrettably don't have access to clean water for the sake of hand washing. So there's a vicious cycle in that potentially exacerbates the challenge. And then to round up, I think just in terms of advancing this monitoring network for the sewage shed, there's definitely going to have to be some very intimate linkage between the academia or the research environment and the interaction with local government, specifically your municipalities, and how that information can tie up with the National Department of Health, just to sort of project possible COVID risks moving forward. But I would like to again commend the WRC and every individual who's been involved in the project. And I hope that we can see further advancements with this kind of work. Thank you very much, ma'am.
Thank you very much, Mr. Bashan Govender from the Department of Water and Sanitation. I think before we take any comments and questions, I've seen a few coming in. Request for presentations. We will definitely share the presentation as promised at the end of the session. Can I please invite from the Department of Health, Ms. Elizabeth Maseti, to give her responses. We're still doing okay on time. We're slightly behind, but where we lost, we've gained. So Ms. Elizabeth Maseti, could you please join us on the virtual stage to share your responses?
Okay, thank you very much for inviting me to be part of this important meeting. I am here to represent, yes, I'm from the National Department of Health, but I'm representing the program which I'm managing, the expanded program on immunization. I think we do have some other units in the departments who plays a very critical role in the environmental. We do have environmental units, which is dealing with the environmental issues. And we also have CDC, which is also looking at the communicable diseases. So these three units play a very critical role. So as I'm saying that, I'm just going to speak for the EPI unit. The reason EPI is part of this is because we have, as we have said, that the environmental surveillance has been a complementary tool for clinical disease prevention. So the first speaker has highlighted that the first environmental, it was for polio. So as you know that the program which we're currently in is managing is also looking at the surveillance of polio. So we have started the environmental surveillance for polio in South Africa in last year in 2019, and we have expanded it to all 8 metros in the country this year. So what we have done as a Department of Health, and especially as the Subdirectorate DPI, is that through the collaboration with WHO, our country office, and NICD, all the metros, the sites in the metros, they've been requested to also collect the sample for COVID-19. While they're busy collecting the sample for polio, they also collect the sample for COVID-19. And the other important role which EPI plays in this is because we all know that the country is also forming part of other countries to introduce the vaccine against the COVID-19. Though we know that, I think it was in somewhere in October or early October, after that adverse event reaction in the United Kingdom, that all these studies were just halted. But we are still going to resume because we do have the ministerial committee which is looking at COVID, which also have the 5 streams. And one of the streams is also looking at the population, high population, where after introducing the vaccine, we have to identify which population are they going to start having that vaccine. So there's wastewater surveillance is going to play an important role because it will also help us to prioritize those super spreaders in the COVID-19. And it will play an important role also because we know that with COVID-19, we've got the asymptomatic people who are spreading the virus. So it will really play an important role. And I'm very, it is a pleasure for me really to be part of this important system so that we are able to control this pandemic. So what I can say is it's all about the EPI role in this environmental surveillance. As I already mentioned, that we are conducting environmental surveillance for polio, and together with the COVID-19 in all these 8 metros in the country, and each metro has got 2 sites. So, and some of the things that we are looking at is to expand it to other provinces which don't have metros. And we all know that even with the COVID-19 environmental surveillance, we are also looking at increasing more sites for it so that you can be able to identify the high risk populations in the country. So I think that is all what I can say from the response from myself as an EPI manager. Thank you.
Thank you very much for those inputs, Elizabeth. They are definitely appreciated. It is now 15:41 and we are ready for our wrap up and closure. If there are any additional questions that are specifically for the speakers, this is your opportunity. I keep on looking at the chat box just to check if there's anything coming through. I'm now going to hand over to the CEO of the Water Research Commission, Mr. Desigan Naidu, to enable us to really understand the way forward and then also facilitate the closure. There's one question in the Q&A, and if you allow me, CEO, to just ask the question to the panelists before we hand over to you. The question is, do the partners see a resurgence during the summer holidays? Is there a targeted approach at the holiday cities? This question can be directed to any of the panelist members. Melinda, I don't know if you'd like to respond to that question. That question is, do the partners see a resurgence during the summer holidays? And is there a targeted approach at the holiday cities?
Yes, I think it's a question on everybody's minds. I think it's likely that the summer holidays will facilitate movement of communities and gatherings of communities. So I think we can expect to see increased numbers of cases after the holidays. Whether or not this will be a resurgence, it depends on a number of factors. Firstly, it depends on how much immunity South Africa has already, and that's still a matter of debate, and there are some unknowns around that. We know some surveys have said that there is a level of about 40% in certain Western Cape areas of immunity. Whether that would be high enough to prevent increases of cases when we see holiday movement remains to be seen. So we don't know. The National Department of Health is preparing communications around safe travel in the holidays and trying to heighten awareness of the risks and reminders that COVID is still around in terms of preventing increases of cases over the holidays. But from the surveillance point of view, it is probably likely that we will see some increases after the holidays. And perhaps the other concern would be already, next year when it goes into the winter season. I would be very interested to see what happens then as well. But all these things will depend on immunity, and there are still many unknowns around the immunity levels and how long immunity will last in the population.
Fantastic. Thank you so much for that, Melinda. I see, Natasha, you also wanted to add a comment to that. I'll give you an opportunity to do so before I move forward.
Yes, thank you, Kosi. And to add on to what Melinda said and to answer the second part for City of Cape Town, is that there is a very specific targeted approach by both City as a whole and then together with the Provincial Health Department focused on the holiday season and the local travellers that we are expecting. So definitely this is very much on our minds.
Fantastic. Thank you both for those responses. I would now like to introduce Mr. Devika Naidu, founding member of the Water Policy Group, President of the Human Rights to Water, and CEO of the Water Research Commission, to map out our way forward and close the event for us. Thank you.
Thank you, Kosi. And thank you so much to all those speakers for incredible presentations, starting from William and rolling on through. I had prepared to talk to what this actually is, which is a launch of the phase 2. But I think what we have seen in this webinar, that we have a status report on the South African wastewater surveillance project that is truly something to crow about. And I think that we rightfully are up there with some of our international partners leading some of that way. And so congratulations to all of you for being able to do this. There's been some incredible cooperation. There's been a building of a team that didn't talk to one another for quite a long while, and for some people talking to one another for the first time. And we clearly are in that space where we can say that this wastewater surveillance work has organized for us to build the kinds of synergies we were only theorizing about in general quite some time ago. The second thing that I want to emphasize within that is this international cooperation that we have seen around this project. And I think it would be fair to mention the Global Water Research Coalition, because several of its members, including Bernadette's organization, and Bernadette is joining us from Canada this morning, bonjour. These GWRC members have been leading in the various spaces in the different regions of the world, and hats off to them. And as a collective, maybe we are getting this part of the science right. And this, together with the ongoing work around different treatment regimens, as well as the vaccine development programs, might see us in a very different place in a year from now. I think we can hope for that, and there are some reasonable indicators that we will actually be there. The couple of points that I want to emphasize around this. The first is we are doing an interesting marrying here. You know, in the water domain, we talk quite a lot about the one water concept and around organizing this as if you like, the development paradigm around future water management systems. And I think through the course of this project, we're building a very useful bridge to something else that we've been talking about, at least in this country, since 1987, since the ANC's paper on health policy in preparing for governing, around the concept of One Health. It was called something different then, and it has moved on quite a bit in the discourse. But combining the One Health concept and the One Water concept organizes a nexus that will certainly take us into a much more useful place. The second point I want to emphasize is that, while we've been talking primarily COVID, as we should, because this is something that is overwhelming currently, there are some offshoots to this that are incredibly important. The first of the offshoots is that this gives real and practical impetus to the global acceleration framework. This is the program that Antonio Guterres, the UN Secretary General, launched just about a month ago in an initiative that's led by UN Water around declaring this 2020 to 2030 as the decade of action to try to get us back on track and as close as possible as we can to the SDG target number 6 by 2030. But we know that in doing so, we will add some incredible value to every one of the other SDGs. And maybe primary to this is SDG 17, the partnership concept that will enable this to work in a particular direction. The second thing that I want to emphasize is that, during an emergency, there are certain things that are just a sunk cost because you have to deal with the emergency. This is not how we are viewing this program. We are viewing this as a building block to a water observatory system in this country. And it's very useful that Natalie Mayette in her opening presentation talked about a concept that is now starting to come to fruition, hopefully rapidly, around this public health institute idea around a global and a local health observatory, rather, which hopefully will be a chapter in the global health observatory. So the idea about organizing these observatory concepts to come together is a very useful one, because water quality is something that's going to be with us for a much, much, much longer time than COVID-19 or any of its successors for that matter. And this is something that we have to get to grips with, because this is a very, very important component around ensuring our future water security in the system. And Bashan, with different words, also emphasized that from the DWS. Then the other component that we're seeking to empower around this, and I think it's already happening, is around the local government arena as the theater of major operation around all of these projects. And just recently, together with Minister Nkosazana Zuma and Minister Lindiwe Sisulu, we launched the Water Technology and Innovation Forum for local government. And we're hoping to empower that through participation in this kind of project. And then the last thing that I want to emphasize, Chair, before I round up, is that there is a very particular value add around the South African chapter of this project compared to any of our partners internationally that are playing in this space, be they the KBR or the Water Research Foundation in the States or the Colossus project in Australia, is that currently we are the only ones that are examining the non-sewage sanitation environment. This presentation that Sudhir raced through a short while ago. This is an incredibly important value add, because the reality is that a very large percentage of the global population is in fact in the space of non-sewage sanitation. And some parts of the developed world are also starting to edge into that space. I mean, there are now reports coming out, for example, on the back of the election campaigns in the US around, for example, New York being one of the hotspots in the developed world around no indoor plumbing available to a significant percentage of its population. And this is something we would not have had a discussion about a few years ago. So this contribution around the non-sewage sanitation component of this project, I think expands the field to get the kind of universal coverage we want to have around the surveillance. And then the last point, and by no means the least point, is that we're very clear in the discussions we've been having over the last couple of years. And I had an exchange with Chilitsi Marwala 2 weeks ago around this concept, around how 4IR was always bannered around that movement that would organize into a very different way of looking at skilling into the future. And that is true. And it's also true that this little single strand mRNA virus as organized to be that powerful disruptor that is moving us into a different space. But a very core component is that in the expansion of the skills base that you require, a very important component of that is around building the partnerships across the sectors to be able to work in an integrated, in a synergistic fashion moving into the future. And I think what we're already achieving with this project is moving us in that direction. This phase is only the pilot phase. This is the launch of phase 2. And we're hoping when we have a proposal sitting with the Department of Water and Sanitation around funding for the full-scale surveillance, that by the time we hit that phase 3, we will, I think, be on the road to developing out the right kind of strategy around that skilling that can happen inside the system. So colleagues, as my final note, congratulations to all of you, not only for what you have achieved to date, and there have been many, many organizations already playing inside the space, but also in organizing for a very rapid conceptualization for each of the new markers that keep coming up. And we are able to add very substantively to the global dialogue inside this domain. And together, we will of course beat the COVID-19 epidemic, but we want to do it in a way that really organizes for us to be able to achieve what Antonio Guterres talked about when he launched the Global Acceleration Framework, that we'll be able to go through all of this, not only dealing with the current problems, but organizing to build better going into the future. Thank you all very, very much indeed. Kosi, I'll hand back to you.
Fantastic. Thank you so very much, CEO. And thank you to all of our participants. At this point, we end a very content-rich session. And as we promised, we will share all of the relevant presentations. Look out for our communications in your email. We thank you for your time, and we've managed to save 5 minutes. So that's a cup of coffee. Thank you all very much and have a great day further. You're each free to leave the meeting as you see fit. Have a great afternoon. Goodbye.